In national news, testifying on Capitol Hill today, the administrator for the Centers for Medicare and Medicaid Services, which rolled out the much-maligned website for the Affordable Care Act. She said something we haven't heard yet from anyone in the Obama administration.
I want to apologize to you that the website has not worked as well as it should. We know how desperately you need affordable coverage.
Okay, but what about the people who want nothing to do with this website because they already have insurance they're happy with? She continued to say that Americans can keep plans they like, and Republicans hammered her for it.
I am aware that there are issuers in states who are canceling their old plans, which were grandfathered in, and moving to new plans, which have to meet.
So what you just said about keeping your health care plan isn't true.
No, they could keep it. The issuers chose.
No, they can't keep it. They just got cancellation notices. Why are you saying you can? I don't understand.
All right. Time has expired.
That point about keeping your health care plan, that's an important one. How many times did we hear this from the president?
If you like your doctor, you will be able to keep your doctor, period. If you like your health care plan, you will be able to keep your health care plan, period.
But that was never the whole story. It was simply not credible that the Obama administration and Congress would make a number of sweeping changes to health insurance and everyone would still get to keep their health care plan and their doctor. Back in 2010, the Obama administration vaguely acknowledged this by noting the high rate of turnover when it came to the 14 million individuals who have private insurance as opposed to group plans. Tucked in the Federal Register, the Obama administration noted the normal turnover rate for individual insurance is up to 67%, and that because of changes mandated to plans by Obamacare, turnover would likely exceed that range. We haven't even mentioned the employers who are pushing workers off their plans and onto the Obamacare exchange because it's cheaper. This doesn't sound like if you like your plan, you can keep your plan. And in fact, back in 2009, a young White House correspondent challenged the president on that issue, noting that some of the proposals being discussed might have resulted in folks being forced into new plans against their wishes.
What about keeping your promise to the American people that they won't have to change plans even if employers...
Well, no. I mean, when I say if you have your plan and you like it and your doctor has a plan, or you have a doctor and you like your doctor, that you don't have to change plans, what I'm saying is the government is not going to make you change plans under health reform.
Ah, that's the key. The government is not going to make you change plans through health reform, though the government might impose a situation that would cause a change of plans for you. So the promise was never quite as presented, and yet the president kept presenting it that way. And as I said, I'm in Chicago today. Just a few minutes ago, I spoke with Sue Klinkhammer. She worked for a Democratic Illinois congressman. She defended Obamacare to her constituents, his constituents, but then he was defeated for re-election, at least in part because of his support for Obamacare. She was then unemployed, forced to get her own insurance plan. A few weeks ago, she got a letter from her insurance provider. So you got this letter.
I got this letter from Blue Cross that said, this is a review of your current coverage, that I right now have a Blue Advantage with a monthly premium of $254.88 as of the date of this letter. Please note that coverage under your current plan will end December 31st, 2013. And then they give me my plan options.
And what are the options for it?
The first one is a silver option, which is most similar in benefits to what you have today. The monthly premium for the member named above, which is me as a single person on a plan, is $647.12.
$647.
$647.12.
Wow.
My other option is a Blue Choice Bronze, which is most similar in price to what I have today, but higher, not,
right.
From $254 to, and that monthly premium would be $322.32.
So why not take the bronze?
Well, first of all, it's a higher price.
Right.
But my deductible will go from $3,500 to $6,500.
So some people would say, supporters of Obamacare would say, you're going to get better plans. This is what Obamacare does. It requires that you'll have coverage that you didn't have before.
Right. And I'm a supporter of Obamacare, and this was part of my issue, was that I did tell everybody it would be better. And I understand that all these health essentials that are now being covered, but some of those had also been covered in the past couple of years, like mammograms and physicals and things like that. But I still don't understand why, even if all those are covered, why my premium is going up $350.
And you're not eligible for subsidies.
And I'm not eligible for a subsidy. Now, what really bothered me, and I know there's talking on both sides. So this morning, a congressman from North Carolina, a Democratic congressman, to defend it, said, well, but those policies that people had that are being eliminated were junk policies.
Junk policies.
Right. And that it wasn't a junk policy. It was a good policy. It was in my price range. It gave me what I wanted. It certainly wasn't a Cadillac plan, but, it had a good deductible and a good premium. And again, for people on the open market.
But you can go to an exchange and shop around and find something better, right? Isn't that something else that...
Well, and that was the second part of my problem was I went on October 1st. I went onto the website. Now, was able to register. I was able to get through the registration part. But then in Illinois, they didn't have their premiums up. So they said they would send me a letter with my options. And then the head of Get Covered Illinois did call me, reach out to me after I sent this letter to somebody, a mutual friend. And so I was able to browse the prices. But again, you're able to browse the prices, but you have to go to the carrier website to see what the actual plans are. And I'm assuming with Blue Cross, there were a couple companies that were completely out of range. They were, like $400 range.
Do you regret, you worked for a congressman, a
Right.
Democratic congressman who probably one of the reasons he wasn't reelected was because of his support for
Right.
the Affordable Care Act.
Right.
So do you regret working for him? Do you regret pushing back when constituents called up and complained?
No, because I believe in the health care for all theory. I mean, I'm glad to see the people who couldn't get health care. That was the pre-existing condition. That was a hard.
But you're a middle class American, and your premiums are going up.
But my premium is way up, and I just want. I mean, I have a lot of now conservative Republican friends who are calling me and saying, "Here's the ironic thing. I'm going to benefit from Obamacare," and I'm glad they are. But I just thought that maybe all of them would be put in a pool with me instead of the pool expanding where all the healthy people, kind of went into a higher premium pool. Because then to me it's not affordable. It's available, but it's not affordable.
Our thanks to Sue Klinkhammer for telling us her story. Coming up next on the Lead.